Hello and welcome to the Kingdom Strength Podcast. I am your host, Troy Briscoe, and the Kingdom Strength Podcast, as you know, if you are a regular listener, is a platform where we get to dive into topics of a variety of ranges from strength and human performance to clinical considerations for particular diagnoses and conditions like today's episode will be, and anything else relating to exercise, health, and fitness, as well as topics about the Christian walk and the scriptures and little Bible study topics as well. So it's an honor to get to have a guest on today, Dominic Coe. He is a brother in Christ. I met him at Parker University. I was a trimester 3 student. He was one.
Yep.
We met at Parker Fit. What a delightful time that was. And we've remained friends ever since. And he is in the student clinic getting ready to go off to his last rotation. And he's going to be a baller out in the field, helping patients get better. So we're talking about POTS today, and specifically postural orthostatic tachycardia syndrome. Bit of a mouthful, I know. And Dominic has a little bit of a personal experience with POTS, so he has also poured in a lot of time and effort into researching POTS. So he is a knowledgeable person on the subject, so honored to have him on the show today. And Dominic, we'll give you the floor to just share a little bit about just your testimony with the Lord specifically, and then your experience, student clinic, how that's been going, what you're up to professionally, and then experience with POTS.
Okay. Yeah. So as Troy said, my name's Dominic Coe, and I am a chiropractic student at Parker University. Try 9, almost done, heading into my externship in just a couple of months. So I'm super excited for what the Lord has for me in the future. I am a dad, a husband. So me and my wife have 2 little girls, a 2-year-old and a 1-year-old now. So it's just been a blessing to see how God shapes and forms me into a man as I relate to my wife and as I relate to my kids. So it's just been a blessing and full of obstacles and learning milestones since I've been doing school and then having 2 kids during the program as well. But just to give a little bit of background of my walk with the Lord, mainly I attribute a lot to my original just hearing of the gospel to my dad, who's a retired disabled city of Las Vegas firefighter. He came down with a smoke inhalation injury that caused a plethora of autoimmune diseases, which caused him to begin asking questions of a fellow saint of, why are we here? Who am I? Is this all that there is? So just kind of the big why questions and what questions of who we are as humans and how we relate to the things around us. And he faithfully answered those questions, showed him in scripture where those answers can be found so that my dad could look on his own. Each time he would ask questions and share with my dad, he would come home and share with me and my mom, and just over time started to believe and just reciprocate just those core values of the Christian faith there. And then over time, just as I grew, I saw just how deprived humans could be without Christ, and that God has faithfully provided a way through his son, that if we believe in him, that his death and life and resurrection would be the thing that saved us. And so I am definitely indebted to that and thankful for that. So yeah, and been a Christian for, probably about, I would say, over like 8 to 10 years now. For me, it's just kind of been like a shape and forming walk along the way, as I gained more of a personal faith rather than just reciprocating the faith that my parents demonstrated. Mm-hmm. So glad to have those role models and then to be able to be that role model for my kids now. So it's been a blessing and a joy.
Yeah, no, thank you for sharing all that. My goodness, praise be to the Lord for capturing your heart and you and your dad's heart long ago, and raising a beautiful family now too. And I still remember when I first met you and you said you were a new dad, and I was like, oh my gosh. And you were just starting the program. I'm like, God bless you, my friend.
Yeah, it was fun. Had our first in try 2 and then second in try 6. Both during testing seasons, conveniently,
but destiny is a lovely mother. So
yes, yeah.
But yeah, no. So thank you for sharing that, Dominic. What a joy to get to hear your testimony. And it's something I always like to do is just give the opportunity for guests to share, because it is encouraging. There is power in the testimony, no matter what the topic of the day may be. I like to start off with that. So let's dive into POTS a little bit. Tell us about your personal experience with
Yeah,
POTS.
sure. So POTS syndrome has kind of been a thing, I want to say, since I was 7 years old. I've always experienced some of the symptoms, which we'll get into a little bit later, but just to give like a quick overview. Lots of POTS people suffer with bouts of dizziness, fainting spells, any changes in posture or levels, getting off the ground quickly, or any sort of exertion can really weigh on people who have this condition to
Mm-hmm.
where their body just wants to shut down with either them feeling very almost like dehydrated or just passing out. And the first time I ever had a fainting spell was when I was in second grade. And from then on, I was never diagnosed with POTS as a syndrome. And I saw a cardiologist, had no issues there that they could find. And so then it was just a thing to where you need to just be drinking more water than all your friends do. So that's what I did. And pretty much, I want to say like 1 to 3 times a year, I would have a fainting spell until I got to, I want to say high school, when that started getting faded out. And what I noticed as I got older is that the only times that I would get those symptoms was not under exertion, was not under postural anymore, which was odd because that's not the typical like criteria for POTS, but it was when I was sick, and it was usually when I had a viral illness. So anytime I would get up to use the restroom in the middle of the night, or just get up after kind of feeling fatigued and just very sickly in bed, I would pretty much get like a 10 to 30 seconds warning before I would faint. So finally got a diagnosis of POTS syndrome. And I know that this will be kind of unbelievable for the listeners, but after I had complete asystole twice, so my heart completely stopped twice when I was sick one day with standing up for a while. All of a sudden, my system, I could just feel like, oh, I'm about to faint. I'm about to faint. And I went down, and my dad, who's a trained firefighter paramedic, could not find a pulse. I wasn't breathing and was doing sternal rubs. So kind of like early stages of like CPR and resuscitation. And thank God that I came to on my own before there was any chest compressions or breaths given. And then I was able to stand up. To me, felt like a normal incident, like any other time I fainted,
Mm-hmm.
and walked to the gurney because the ambulance was there, got in, and they gave me an IV. I think they struck a nerve or a tendon because it was so excruciating. I like felt like my arm just electric shock to my brain. And I told them, I announced to them, I was like, I'm going to pass out. Sure enough, I did. And instantly on the EKG, I flatlined for 18 seconds.
Wow.
Yeah, that's when I got diagnosed with POTS finally. Now, for those who have POTS or treating people with POTS, asystole is not a normal occurrence. That was definitely an oddity in my case, and I was given POTS as just a diagnosis to be able to describe to other healthcare providers and people around me kind of what to be aware of because the symptoms were very similar.
Yeah.
But
The
yeah,
cluster.
I praise God that both times he made my heart start beating again because the paramedics just stood there and looked at me. They didn't have the AED on or anything like that. And then for those who don't know, you can't shock a flatline rhythm. So there was nothing to restart the heart in any manner besides CPR. So yeah, thanks be to God that I feel like I am living on borrowed time now. So yeah,
Amen. Praise the Lord, man. Praise the Lord. He wasn't done with you yet, man.
no,
We live to tell the story. That's wild.
yes,
Yeah, no, I remember when you told me that for the first time way back when. I'm like, oh my gosh, dude.
yep.
Yeah,
I was
and
like, can you train me now?
yeah,
Yep.
yeah. You were one of my first clients at Parker Fit.
Yeah,
Yeah, kind
it
of wild.
was a great time.
Fun times. Fun sessions. A lot of great conversations.
Yeah, definitely.
Yeah, so a little bit about kind of the cluster of symptoms that you listed a few there, and I know kind of with you was a common thing I've seen with POTS patients too is standing for a long period of time and having that kind of blood pooling mechanism and not being able to just redistribute that blood flow back up and maybe be a causative effect of the fainting and things like that. So that's one thing you've experienced. Anything else across the board that is pretty common with POTS in terms of symptoms?
Yeah, so yeah, kind of the basic first symptom that you're going to see with POTS patients is it's going to be a heart rate change.
Mm-hmm.
So they'll present with tachycardia, so a faster heart rate from going to sitting to standing posture.
Mm-hmm.
And that's usually the primary criteria that doctors will use to diagnose a patient with POTS.
I believe
So
it's, yeah,
to
30
say that
increase.
again?
I believe it's like a 30 beat
Yes.
increase.
Yep.
Okay.
So yeah, with a typical adult, it'll be like greater or equal to 30 beats per minute increase in heart rate. And then with adolescents, it'll be 40 beats per minute. And that's within 10 minutes of standing and that's without any orthostatic hypotension. So no blood pressure changes that can be seen with that. So there is kind of like this nuanced area of the difference between like POT syndrome, which is an orthostatic syndrome, so orthostatic being postural related. And then there are the hypotension area side of things. So you have the heart and then you have the blood pressure side. And they often present with the same symptoms, but the kind of mechanisms can be different. But
Mm-hmm.
the blood pooling factor, it is kind of interesting that the blood pressure won't really change despite that being one of the primary kind of theories and mechanisms behind why POTS happens. So yeah.
Yeah, no, that is an interesting outcome there, that there wouldn't be that change in blood pressure. So 30 beats per minute increase at least with adults, and then 40 for kids, because kids have a higher just resting heart rate in general. So I presume that's
Yeah.
the
Yeah.
case there. Cool.
Yep.
And yeah, let's continue that conversation. We talked about symptoms a bit,
Yes.
about other diagnostic factors as well. I know we talked about the heart rate change with the blood pressure remaining the same. Is there any other things that is considered when looking at POTS? Because I know it's a multi-system
That it is.
condition, and so what other systems could one expect to look at if there are clinicians listening to this podcast here?
Yeah, so definitely first is heart because that's going to be your primary symptom, like
Mm-hmm.
we mentioned. Other things to look at is going to be a change in like sympathetic and parasympathetic tone. So that's another like even in those areas, like a lot of these kind of syndromes are very nuanced in just kind of like the why they happen, and then even in like some of the like how the disease can happen, like how to treat those areas can be kind of like go to and fro. But yes, one of those things would be looking at sympathetic. So just not being able for the nervous system to basically turn on and slow down the heart rate to be able to control blood pressure in certain positions, and then just to be able to not have such like a almost psychological response to like fear or other things that symptoms we'll see with like sympathetics. Another thing would be looking at a lot of times there'll be an electrolyte imbalance in POTS patients. So just an inability to hold on to certain minerals. And obviously the big ones that they'll look at is sodium and potassium. And then so they are saying, which is funny because like a lot of times like if you go to your standard cardiologist, they're always looking out for your salt levels and your cholesterol. But if you present with POTS or a similar condition, they will be like, you need to drink a whole lot of water, more than the average person, and don't even think twice about putting salt on your food or consuming salt because you're going to need every little bit. So that I would say. So we have heart, so cardiac, we have the sympathetics, so the nervous system, and then we have the like adrenergic system, so just the electrolyte stuff. And then they've also noticed some things where there can be like hypovolemia in the blood tissues where there's pooling as the veins in the leg aren't constricting enough to allow for when you stand up for that blood not to just stay low and to be shunted up. So that is another area. And then there's other theories out there of maybe some possible associations with the vagus nerve. So here we are with parasympathetics again. and then some of the receptors in our cells and in our nervous system that kind of controls like uptake of electrolytes and then sending different signals to the brain and to the body. So yeah, this is what they call an autonomic condition. So basically the things that we can't physically control, everything underlying seems to be happening, and then the physical symptoms we present with can be many with POTS patients dependent on the variants of POTS.
Yeah, no, definitely a complex diagnosis and
Yeah.
lots of moving parts to it. And I think you summarized it really well there with kind of laying the foundation that we'll build upon in this conversation today with defining POTS and diagnostic criteria and what to look out for symptoms wise and what's happening from a mechanistic standpoint as well. But awesome. And then some potential association with, immune and things like that as well.
Yes. Yeah.
And I would love to hear more thoughts on that if you have researched anything with that too, because that's kind of new for me as far as my understanding of
Yeah.
POTS. I kind of read up on some things before this conversation, and of course, working with people in the clinic currently with POTS, I'm having to stay sharpened in reading the existing evidence in the literature out there. Honestly, not that much all in all, but it's just slowly growing, and which is why I was excited for this conversation too, because you've scoured the literature. So is there anything you found, even from an immune standpoint, with POTS?
Yeah, but before I get into that real quick, I'll just kind of talk about what like got me into that outside of my own condition and
Okay.
diagnosis of POT. So I'm currently in the Masters of Nutrition, Functional Nutrition Masters at Parker University. So I'm about a third through the program so far, and in one of our classes, we were tasked with creating a nutrition notebook. So for those who aren't familiar with the purpose of nutrition notebooks, a lot of dietitians, anybody who works with like any sort of nutrition, functional health specialists, even chiropractors, nutrition specialists, things like that, they will sometimes compile their own nutrition notebooks for conditions that they have a passion for treating and trying to know everything about. And then there's also nutrition notebooks available to practitioners of experts who's written on certain conditions and topics to use as a guide for when you're treating or walking through something with a patient. So we were tasked to write one about a condition we're interested in. So I chose POTS. And as I was gathering data, like the first data that I came across was actually NIH expert consensus that was done back in 2022. And it basically was brought in doctors from all over that have treated, have done research on this in the past, and just have been like the guys, the docs behind this condition, and basically describe everything, what the diagnostic criteria is, what tests to do, how to diagnose it, some potential treatment factors, and all associations. And so after going through that, that's when I just started going down the rabbit hole of the different conditions that are listed. So my nutrition notebook that I kind of compiled actually started turning into, instead of just POTS only, it was POTS in relation to vagal nerve influence. A lot of that coming from just my own experience in chiropractic and some of the potential benefits there that we see with just manual therapy. COVID-19 has been kind of the main virus that has been plaguing us over the past couple years since 2020. And then mast cell activation syndrome, which is a little bit more histamine related. And then the last one, which I found incredibly interesting, is hypermobile Ehlers-Danlos syndrome. So hypermobile EDS. And those have been kind of the primary things and associations I've seen with POTS so far.
Okay. So just I know you were in previous conversations we've had, you said about 40% of hypermobile EDS cases have POTS. Is that correct?
Yeah. So to give you a kind of statistical breakdown that they found in this expert consensus as they were compiling all the data, they found in an estimated of 40% of patients that were diagnosed with hypermobile EDS had an association with having POTS as well.
Gotcha.
Now, on the other hand, this is why I kind of got confused, is that, and it's in the same paper, is that they were finding that 25% of POTS patients had hypermobile EDS.
Okay.
So you're kind of seeing like it's almost like a chicken and the egg conversation. And just to give like an even more background as they described in the paper, so what they're finding in like the patients who are actually on the spectrum of HEDS is that they're having that blood pooling phenomenon. So there's an elasticity in their venous tissue, not allowing for the blood to continue going up into the brain. So they're losing perfusion of the brain as the blood pools when they stand up. Now, on the other hand, there are seeing people who actually have POTS also demonstrating some of the criteria for hypermobile EDS, although it might not just be the blood pooling phenomenon. So very interesting.
Huh.
And those are kind of high numbers to think about it, if you think about it. But it does make sense because the group that they're seeing the most amount of diagnoses in is in your females. And they're kind of seeing it in two different areas. When you're seeing it in adolescent females at the beginning of menses, and then you're seeing it in the middle-aged population as well. So it's that there's a lot that they speculate could be associated with it, which kind of comes into play of us as practitioners, as people who are interested in these topics, to kind of do the deep dive with our patients through labs, testing, treatments, and things like that to kind of help either manage and or help with some of these underlying problems.
Yeah, I know that's fascinating, and mechanistically that would make sense why someone with hypermobile EES would experience symptoms like a cluster of symptoms,
Yeah.
the POTS, right? With not being able to shuttle that blood back because of the elasticity of the tissues there. So yeah, no, that makes perfect sense with from an EDS standpoint. What about like COVID and other associated
Yeah.
conditions? Like what would you find on that?
Yep. So after just going through that, what I found in the expert consensus is that they noticed a huge uptick in POTS diagnosis after the advent of COVID. So upon the pandemic, when people were getting sick or vaccinated, which they also mentioned, they were seeing a all of a sudden symptomatology that mimicked POTS. And so that led me to go down and look for particular research. So there's a cardiologist that I'm very fond of who is actually one of the foremost researchers in cardiology out there, and he's located in Dallas conveniently. His name's Dr. Peter McCullough, and he was a very big spokesperson during COVID and just trying to provide treatments and avenues of care for people that were suffering either just on the basic symptomatology side or were nearing death. And he actually had a paper that I read that talks about one of his COVID protocols as well for a more natural approach to treatment and viral care, of finding a huge association with POTS all of a sudden, whether that be due to the uprise in the association with clotting in people that either got the disease or were vaccinated, but also in the kind of pathomechanics of COVID itself. So when I was reading one of their research, they were finding that the spike proteins that are found in both the virus itself and the vaccines, they actually attach to our ACE2, so ACE number 2 receptors in our cells, which pretty much control our angiotensin systems or ability to control like water balance and electrolyte balance and things like that, and which is very associated with why POTS patients come up with nervous tension, fainting, vasovagal events, and things like that. And they were finding that the spike protein, they bind to those receptors and they prevent binding to all other factors, and that they were now seeing this uptick in people who weren't able to now control their kind of hydration and things like that because of this blockage. And so his protocol is actually developed on how to prevent the binding and how to detox the spike protein itself. So, I mean, if that's interesting to get into, we can definitely talk about just some of the supplements that he's like discussed for that. But I did find that interesting of like all of a sudden, like even these researchers that have been tracking POTS for 10 plus years were like, wait, why was this just like nobody heard of it? Like you could honestly go to some medical doctors. I remember having some doctors myself in the past that just did not know what it was. And now it's like it seems like everybody knows because now all of a sudden you're seeing, I mean, I have a friend who never had dizziness or issues, and now all of a sudden, since COVID and having COVID, now she is diagnosed with POTS. And it's sad because now you're seeing people who were perfectly fine, and now all of a sudden if they eat too large of a meal, they're going to be dizzy for the rest of the day. And so I'm thankful that that's not something I deal with. So, because like I do jujitsu, so I'm able to go from ground to standing very quickly and have no symptoms. Thankfully now, that might have not been true as a kid, but now there's people who were fine and now are experiencing to where they can't even eat a large meal. So it has just this idea of now there's pooling in the stomach and in the gastrointestinal system trying to help you
Yeah.
digest, and so there's just less access to perfusion in the brain. So it's very interesting.
Yeah, no, that is interesting. Huh. That's fascinating. Some of the research I was reading before the call today was actually about like some GI disturbances and related
Yeah,
symptoms to POTS, with kind of
yeah,
that most common areas for that pooling is, the thorax into the thighs. And, like you're mentioning, after a meal, the blood needs to, go to your GI system in order to digest said food that you just took in. And if it's pooling there, not getting to the brain, not getting that perfusion, and leading to some dizziness, lightheadedness, and potential fainting, like, some of the stuff that you've experienced in the past. So it's wild, the whole cluster of mechanisms that could be at play. And that just goes to show each person is different, right? And each case is individualized. So while POTS, as we've discussed so far in the conversation, has a cluster of symptoms to be aware of, and, somewhat of a standardized diagnostic criteria and things to look out for. But, the way you experience and respond to certain things in your environment and different positions and this, that, the other is different from someone else who has the same like diagnosis syndrome, right? This
yeah,
cluster.
yeah,
It's so individualized. So it's cool as clinicians we get to kind of understand the growing body of literature, and understand also that is wise to be the evidence informed, to kind of gain some more background on what could be going on mechanistically, as well as different treatment interventions for said, people with POTS and other like dysautonomia and heightened like sympathetic situations too. And I think this would be a good tangent, if you're down, to go into more kind of interventions and everything like that. I know you mentioned like supplements, everything like that. So we can start the conversation there, or we can go to more common interventions if you would like. But
yeah.
where's your head
I
at
think
there?
before we do that, I have a good list of like in the individual systems of the
Yeah,
body of like what symptoms to kind of expect, and then I think we can
perfect.
definitely
Yeah.
go down that rabbit hole for sure. But just to give an idea, because I think the most helpful thing as I was reading through and kind of the recommendations of these
Mhm.
doctors was to have a very open mind when you have patients that come and present with you to you with odd symptomatology.
Mhm.
Yes, one of the primary ones is going to be fainting and change in heart rate. And a lot of patients are going to tell you that they feel like their heart is racing, unless it is a huge jump in heart rate from sitting to standing, but they can tell you that they're dizzy and things like that. So here's just some things that they listed out to be aware of. And so when we're talking about like autonomics and neurological things, you can see tremors. So just resting tremors, which is something I've always dealt with, which is I found very interesting. Anxiety, migraines, angina like chest pain, heat or temperature intolerances. Cardiovascular, you can get sinus tachycardia or other arrhythmias. So they kind of left that broad. So AFib, like all sorts of different things. Hypovolemia, so just reduce volume of water and electrolytes, things like that. Reduce cardiac stroke volume, exercise intolerance, palpitations of their heart, and then pre-syncope or syncope, so fainting spells. In gastrointestinal, you can see nausea, vomiting, diarrhea, constipation, so all over the board. Sometimes they'll get early satiety, so feeling full sooner. And then they also can present with bloating or delayed gastric emptying.
Okay.
So kind of odd. And I think this kind of plays into the fact of like, it kind of depends of what the contributing factor is. And there isn't this causes POTS. It's these things can potentially contribute to POTS. because it's a syndrome. It's not labeled as a disease. So since it's a syndrome, it's kind of a catch-all term for the
Mm-hmm.
symptomatology that you experience. So, and then just a couple of last things. So with immune, you can get in the like immune column, you can get flushing, different types of skin changes, like pinpoint red dots, trouble breathing, dryness of skin, sometimes headaches, excessive like diuresis, food, or like environmental reactions. So they're finding that a lot of POTS patients tend to have higher histamine responses to certain things. So that's something to be aware of if you're guiding your patient nutritionally, to maybe consider avoiding higher inflammatory foods that cause histamine responses. And then lastly, in like the MSK column, you can have joint pain, instability, hypermobility, clumsiness, poor proprioception, frequent injuries, and delayed recovery. So it was kind of one of these things is like, here's a full breakdown list. The main thing is the heart rate change, but these are definitely things in a history that you can be aware of that can be contributing and or related. So that just kind of gives us an idea. And
Mm-hmm.
then I think the biggest things too that they found as associated in their results, like they found 40% of POTS patients have migraine headaches, 30% have irritable bowel syndrome, and then, like I said earlier, 25% have hypermobile EDS. And then going down the line, at least, gosh, 16% of people they found had autoimmune diseases. So the big ones they noticed were Hashimoto's thyroiditis, celiac disease, rheumatoid arthritis, and lupus. So those were the big ones.
No, that's awesome. I think too, for the listeners, I could put this expert review into the show notes if people are interested in
Yeah,
diving
I'll definitely
into.
share it with you.
Yeah, I appreciate that. I think that'll be very helpful. But yeah, that definitely gives a thorough overview of kind of the cluster of symptoms associated with the syndrome. And, again, each person's different. So it might be some of those, different variety of those aforementioned symptoms. And that's what makes it kind of challenging, right? But when it comes down to it, classically you see that heart rate disturbance, the presyncope, his syncope, and just a dysautonomia and upregulation of the sympathetic nervous system. And it's been fascinating to learn from you even in this conversation, but like we talked about before we hopped on the call, is getting to see it in real life with the cases that are coming into the clinic, which has been really cool. And seeing uh, Dr. Brittany, she is phenomenal. I'm learning a lot from her on this regard as well. And she's the kind of front neuro provider over at Parker Performance Institute, and she's been a gem. So if she's listening to this, shout out Dr. Heroes. You're awesome.
Yes.
But anyway, so any other thoughts before we hop into interventions and things like that?
I think too, just since you brought up Dr. Kuros, it's
Mm,
the cool thing about POTS, and I mean, is because it's so like the spectrum is so wide, being able to have just kind of like a team of providers or finding somebody that at least can cover some of these like variables. Because like so many POTS patients can have significant change with like a funk neuro provider to
mhm,
then start working on things like eye movements, balance, coordination, calming down sympathetics, and helping with parasympathetics, and just helping with like balance between those, that you see so much changes in things that maybe they even start having changes in like gut issues because now the parasympathetic sympathetics are more regulated. And then when you go the nutrition route, like you can see changes there that can stimulate things upstream that you may not have some symptoms. So like a lot of it is like what I've been presented with in just traditional medical field is a lot of it is going to be symptom management and
mm,
kind of the benefit that people like functional health specialists, neuro specialists, some chiropractors and nutritionists is that you can attempt to get to one of the root causes or a root cause and start making real change that medication might only mask, or it might help and change it, but there's not as many side effects. So there's definitely like depending on the severity of your personal health history with POTS, it's definitely one of those things to like maybe try out some of these other avenues to maybe help you with better longevity. So if you want to get back to fitness, finding somebody that can help you there, or finding a personal trainer who's aware and can notice your signs so that they don't over push you, or if that there is an incident, you're not falling and you're either being caught or being guided on a safe place to kind of go through the process that is going to occur with like fainting. So there's definitely a lot out there, because obviously first thing is first before like we get into just like some of like the conservative management. POTS patients do need to be assessed by a cardiologist, because a lot of times, like I mentioned, just in the symptoms of the heart category, there can be palpitations, there can be different arrhythmias. And if that's the case, the primary thing needs to be is that the red flags are ruled out, which is true of every case.
Hmm.
And because this is a very and can be a very serious condition, like let's make sure like we can rule out underlying developmental issues or things like that. Sometimes electrophysiologists can be very helpful if it's like an electrical problem. So in my case, I have a pacemaker to prevent my heart from ever stopping. So not a defibrillator, just to make sure my heart rate doesn't lower too much and if a fainting event occurs, but just things like that to help rule out those things that could cause death. And then from there, how can we change longevity? And I think that's where we in this conservative and kind of eclectic space of care with rehab, nutrition, neuro, all these things can have such a huge benefit on the patients and then just in collaboration with a medical team. So yeah, there's lots of potential.
Yeah, no, that is a really good point. Really, really good point with that co-management and, from a conservative standpoint, being sure red flags are ruled out. Like you said, that is
Yeah.
true of any of any case.
Yes.
Always doing a thorough history and exam, ruling out red flags, and doing your due diligence, and being sure no harm will be done with going through conservative trial of care. So let's get into it from a conservative standpoint. What what are your thoughts, or what have you researched about interventions when it comes to POTS?
Yeah. So with anything, I mean, this is like some of the stuff we get into is like definitely stuff like for patients or providers just to kind of work through what would be the best thing for your individual patient, as we discuss that it is kind of on a wide spectrum. But
Mhm.
some of like the conservative treatments that they found is actually having one of the things that they mentioned is considering withdrawal of certain medications that could exacerbate symptoms. So I didn't mention this category earlier, but there's also medications that can cause POTS syndrome. So
Medically induced.
yeah. So causing things of like lack of perfusion or dizziness or vomiting and things like that. So that's kind of the first thing is like what medications are they on and could it be that medication? So
Mhm.
that might be fluctuating the symptoms. So just kind of reviewing like just a quick note, reviewing things like stimulants, diuretics, norepinephrine, and then reuptake inhibitors, and then other like heart rate raising agents are the ones that they noticed were the big ones. And just obviously that's definitely a co-management thing there for sure. Outside of that, then we have the basic things, increasing water intake. So they recommended in the consensus 2 to 3 liters per day, and then with that just making sure that you're balancing that throughout the day and with the activities, because a lot of POTS patients, like people will tell you like if you're not aware of it, they'll just tell you it's just dehydration, that's like why you're fainting. So at least eliminate that factor that it's no longer because of dehydration, because people like me, if I get minorly dehydrated, I feel like I just need to sit down and like I got to stop doing everything I'm currently doing. So that's a big one.
Mhm.
And then next with that is just increasing electrolytes. The main one they found is sodium, so 8 to 10 grams per day is what they recommend. Some of the side effects would be like hypertension or like peripheral edema and things like that. So what
Mhm.
they recommend is doing like buffered salt tablets, or just like kind of grading that throughout the day, of course, or doing a more holistic like electrolyte balance that has like your minerals, that is a true salt, like a sea salt that's providing you that balanced delivery there. Other things that I found was interesting was there are compression garments that
Mhm.
are at like 20 to 40 millimeters of mercury compression is kind of what they're finding is the best. And they have a couple of different types. So you have abdominal and leg compressions, and that can kind of help with those who have like blood pooling issues. and that might help with like the dizziness and the fainting spells. And then the last thing, which is kind of your wheelhouse, Troy, is exercise training. So kind of using like a graded exposure model. If you're not able to do this, let's get you to this point, but gradually and work through it over time. Obviously, symptoms can happen. Fatigue is very likely. And so the biggest thing is like making sure you have like a trainer, or if your symptoms aren't that bad, you're just very aware and know how to take care of these symptoms as they come up and can recognize it, and that you're just making increment improvement throughout trying to increase blood flow and regulation and tissue perfusion. So exercise is great.
Yeah, and this is a conversation I've had with Brittany as well, with exactly that question, exercise considerations for POTS patients, and the people that we've seen so far together in at Parker Performance Institute, with kind of partnering with each other on the patients and patient care, is introducing exercise with kind of a low level isometric for the lower extremity, and pairing that with other symptom modification strategies like kind of like we have talked just before we clicked record on the call today about, like parasympathetic upregulating, sympathetic downregulating strategies like RPSS. And we have a tool called the ResiMax. You can literally put it on your neck, and the RPSS can be applied to different areas as well. But the thought process is to upregulate that parasympathetic and downregulate sympathetic drive, just to help the system kind of be a little bit more calm, and try to reduce those adverse effects that exercise may have in those patients in those contexts, to kind of layer those together in a way.
Yeah,
And
that's neat.
the thought process with the isometric is actually to get that muscular contraction around the venous structures, and the thought process is to shuttle the blood a little bit more effectively and back to the heart, and therefore increase the stroke volume and cardiac output to increase the perfusion. So same idea probably with the compression garments that you were mentioning too, but it's a way to also introduce exercise and that graded exposure model. And another thing I was reading from an exercise standpoint, and it was just a paper before our conversation today, was again, to tolerance once symptoms are kind of under control, and within tolerance, just a slow bike 5-minute session, if symptoms increase, like conclude the session, but try to shoot for just a few minutes, and then, take a day or two off, go at it again, same time frame, and then just keep tabs on what the symptoms are doing during and after the session, and slowly just increasing the duration of the bout of cardiovascular exercise, because it is something that is huge for POTS cases and has great outcomes. Cardiovascular exercise is great for anybody, but when it comes to increasing that capacity for the cardiovascular system, and actually getting that constriction too in the periphery, and actually shuttling the blood and increasing the perfusion and increasing stroke volume, that is going to be huge for those cases to decrease the symptoms of syncope, presyncope, and regulating the heart rate as well. There's also exercise intolerance with POTS cases, so you got to be sure they're ready to slowly introduce that exercise regimen. So there's other conservative strategies that you just talked about with the drinking of water and the salt intake and conversation about medication too. Of course, like you mentioned, that is not a Cairo conversation. It is good to take note of and then work with another provider, because we can't give recommendations on anything like that. But it's definitely good to be aware of. Even with medications that they're on, I'd love to hear your thoughts on this. To a lot of the patients that are coming in are on medications to decrease the heart rate. So like beta blockers and different pharmacological interventions to decrease heart rate and kind of help with symptoms there, which is effective, but obviously may not be a long-term strategy there, but maybe something to do early on to better symptoms. But what are your thoughts on the pharmacological interventions there?
Yeah. So like you said, you have like the heart rate inhibitors and things like that, like the beta blockers. I was initially prescribed beta blockers when I had my incident, which
Hmm.
is funny because my problem, at least like there, so what they would notice is my heart rate would like increase dramatically when I would get up from the hospital bed when I had my incident, and then it would plummet. And that's when I would start getting my symptoms. But yet I was still prescribed when I left the hospital beta blockers. And I'm thankful, like my doc did say, like this is like for emergency only. There's no reason you should be taking these unless like you feel like your heart's racing.
Yeah.
So I'm very thankful about that. And I was blessed with a doc that actually did a lot of research prior to debating which type and if he should put a pacemaker in me. And he spent, I think, like 3 days. Fortunately, I was in the hospital for 3 days, but he would come in and visit and was like, I'm not fully convinced yet. I still need to do more research and figure out what's out there and talk to fellow colleagues. And then next day, I have a couple more ideas, but I don't want to jump the gun yet because at that time, like I was 18 years old, so he knew that whatever he did would be a permanent thing, and I'm very thankful for
Yeah.
what he did. And so like he gave me those just in case. I never took them. I didn't need them because I never had issues with feeling like my heart was racing.
Hmm.
But definitely for people who do, it can be very helpful. But like you said, the problem is with those types of medications is that it's not going to fix POTS and it's not going to work with the root cause. So if you're trying to increase stroke volume, if you're trying to increase their ability to withstand um, exercise, withstand postural changes, they can't be on beta blockers because they're now going to be more fatigued and they're going to have more issues with it. So it's definitely a fix when we're like in an emergent help when we're in an emergent state or have very particular symptoms that are more in the medical category of things.
Hmm.
But once that transition happens, there definitely needs to be some sort of change there so that they can start making change. Because I also think too a lot about like what you said about like the isometrics and things like that. A lot of it can just be strengthening the heart, right? Doing good cardio in a graded format that now all of a sudden is telling their brain, which is telling their body that we don't need an emergent response when we're standing up. We're okay. We just did a squat. We just did a Turkish get up or we just got off the floor with a weight. We're fine. So when you do that, when you're sitting in class, when you're sitting at your desk, we don't need a 30 BPM increase in heart rate per se. So like there is definitely some benefit there. So helpful in those instances to definitely use medications for what they're meant for and helping with symptoms and helping you to stay alive in certain cases. And then once we can make that transition, let's get to work with
Hmm.
people who are aware of this for sure.
Love that. That is beautiful. Couldn't have said it better myself.
And then
And
obviously like there are other medications to help with like the other
yes.
things like nausea, vomiting, things like that. So yeah, there's
Yeah.
there's there's stuff out there.
Yeah. I was about to, start the monologue about our stellate ganglion, but we can save that for another day.
We can talk a little bit about it if you want.
Yeah. I mean, what are your thoughts there?
Yeah, so what Troy just mentioned, there has been some associations lately in kind of the myofascial world of there being a relation to the stellate ganglion, not particularly to POTS, but maybe an AFib scenario, which can be still interrelated, and there possibly being something to where there can be some sort of stimulation of the stellate ganglion in order to calm down the SA node of the heart and help with heart rate regulations and things like that. So, I mean, man, it is super interesting to see because, like, so far, and like you mentioned prior to when we recorded, like, there being some case reports out there of them doing stellate ganglion blocks to help with AFib like pathologies. But yet, there's some other things out there from like experts in like myofascial where they're trying to look into. So, obviously, it's not a treatment for every practitioner because it is kind of scary and invasive and can be dangerous. But there's definitely things out there which I'm like excited to start getting into. So that's I mean that is my next steps with this paper is I want to start interviewing professionals myself in
Hmm.
this field and just getting their ideas because I feel like that's one of the things that can kind of lack in our modern day is that maybe just like in our Western culture is just being able to just throw ideas out there of like some experiments and things like that of like what has been going on, what are some other people's thoughts, what are their experiences, and just kind of coming together and trying to figure out like, hey, could these things work? And
Hmm.
then getting some more interest. I mean, that's how a lot of research starts. So that kind of thing needs to happen before that. But yeah, I'm very curious in just things like that. So I've personally experienced it. It was kind of crazy.
Yeah,
So
that's why I wanted to bring it up.
there's great docs out there trying to do some things. I've talked to Dr. Mike Leahy, who was the one who kind of introduced me to the concept, and I've talked to Dr. Michael Shacklock as well, and he hasn't done anything personally himself, but he's worked with others that are kind of in his realm that have started experimenting with these things and are seeing some extraordinary results. So there's potential there. Because I was just asking him, like, can simply just the basic neurodynamics stimulate the stellate ganglion because of the interaction of all the TOS nerve structures, and then you have the stellate ganglion, which is like on the anterior body of I think like C7 T1. And so it's like those structures are so close, and there's, as we're finding, as the fascia culture kind of blows up and research comes out, it's like golly, the things in other areas, spaces that they're starting to find that can change things. So to
Yeah,
me, it's just extraordinary and definitely a worthwhile. I think I'm hoping that there will be research coming out soon on things
I
like
think there
that.
will. It's just a growing body of evidence there. And just to give some more clarity on that one study too, specifically with POTS, with the implications for POTS, there's one documented case study for a stellate ganglion block with having positive outcomes on POTS symptoms,
Wow. Yeah.
which was interesting. And presumably, that particular individual with POTS, from a mechanistic standpoint, was probably a cardiovascular,
Definitely. Yeah.
situation going on, because of the blocking the autonomic regulation of the heart to the SA node. That was the theory in the paper
Hmm.
about what's going on there and why that could have been such a beneficial response. They said that, even I believe it was 4 months is when like the lasting effects of the of that maneuver, and the injection lasts for maybe a 24-hour period, 48-hour period. So the fact that there was decreased symptoms for a few months was kind of fascinating, that the effects would be so lasting. And because it's a complete block of that sympathetic connection there, so that would make sense to why there would be benefit if that person in particular was having more of a tachycardia or fibrillation sort of symptomatology, and that would track. But I'm just curious if there will be more case reports or literature coming out maybe about the stellate ganglions.
Yeah.
TBD there. Maybe we'll be back on this podcast discussing more literature. That's
Yeah.
But anyway, I know it was a topic of interest for you, and same for me. So I thought I would just
Yeah.
throw it out there just for a little bit at least.
Yeah. Let's do it. Definitely.
Yeah.
Yeah.
Um, but also, anyway, we're gonna wrap up here in a sec. Before we do, any final thoughts, considerations you want to leave to our audience? Again, many of the listeners are practitioners or students in Chiro PT school or coaches and trainers. So when it comes to POTS, is there anything you would want to leave the listeners with?
Yeah. So definitely for those who I think that this is kind of the most helpful space that we can be if you're not at the stage or wanting to like do a deep dive on certain root cause things and start doing interventions there, because obviously there's inherent risks with that with particular patients. Is just being able to provide your patients, provide your clients, or for those out there that are struggling with it themselves, ways to just help them not have the scary moments happen. Because POTS, I mean, the hard thing about it is scary. A lot of the symptoms are scary. Like, man, when I would say, like, my family will joke with me that I'm such a baby when I'm sick sometimes because, like, I will just want to stay in bed, like, if I'm really down with, like, a viral illness because I don't want to go through a fainting spell again. And now that I know last time my heart stopped, there's obviously that inherent fear of that as well. And there's just other things where you don't feel safe and hope that doesn't happen when you're driving, when you're out and about and you're by yourself. So things like that. So I think some good practical ways to just be able to help those out there is have cell salts with you at all times. So, I mean, you can call them your emergency salt stash. So basically, we use something called bioplasma, and it's just a mix of different minerals and cell salts. And all it does is you just take these little salt tabs, dissolve them under your tongue, and which is one of the quickest ways to get it into your system and your bloodstream and into the brain and heart. I've had occurrences where I'm feeling dizzy or feeling flush, and I take those, and those things kind of go away. So those are helpful if you're feeling dehydrated, things like that. Always having water with you wherever you go, taking that, at least in some cases, that can kind of be a thing where you almost a protective guard per se to make you feel a little more safe so that if you feel dehydrated, you at least have something to go to. Another thing is one of the symptoms that they've noticed like pretty lately, and I think this is more related with COVID, is for those that experienced it due to COVID, eat meals slower and space out eating a little bit more and maybe start prioritizing things that are higher in nutrients and electrolytes. So one of the things I found that was really neat is that they talked about some of the research articles I read talked about eating more stews and broths and things like that because they can provide a such a nourishment and they're so easily digestible because it's been sitting and brewing in a broth, right? And it's broken down a lot, so it's easier to digest on the symptom and readily absorbable. And I always feel good anytime I'm eating things that are made with broth or stews or anything like that. And other than that, I would say exercise. Get people around you, your friends, your family.
All right, could you say that again for the people in the back?
Yeah, exercise. Yeah, and get people around you, friends and family that are, and teach them what the symptomatology is if they don't know. Teach them what to do. So one of the things I found with me anytime I faint is, or anytime I feel faint, I will announce it to the people around me and I'll just sit down and I'll quickly just give like a reminder, just like, hey, just watch me. Don't get scared. Like I'll probably pass out, raise my legs, things like that. So putting legs elevated. So if you can, prior to those events, at least have your family and friends and those around you be aware of what it looks like when you feel dizzy and then what to do when those things happen to be around you if they need to catch you and or just monitor you in those times. So at least these patients can have support and a community around them that respects those areas and can at least encourage them and be around them. So yeah,
Mhm.
those are definitely the big points and takeaways I would have that I've found super helpful. So yeah.
Yeah, no, thank you for those considerations and takeaways. I think those are very valuable. And just one note on the exercise standpoint, I know I jokingly said, yeah, rah, rah. But when it comes to this population, certainly go see a provider if you are dealing with POTS or sensitivity to positional changes or exercise intolerance where you do get really dizzy or faint and you're concerned about such a thing. Yeah, good. Just do your due diligence. Go get it checked out. We do not want you to be suffering and going through it. So there is a growing body of literature to gain support and advocacy and intervention strategies for people going through POTS symptoms. So if you have any questions of where to find such a provider to help you out, don't hesitate to reach out. And there, Dominic and I, we know people across the country that may be able to help depending on where you're at if you're listening to this somewhere. So
Definitely. And then also of note too, just wanted to add for those that you may think are associated with like COVID and those that kind of history kind of correlates like, oh, they had COVID and then all of a sudden they had this. The POTS syndrome is definitely start delving into. There are protocols out there that are readily available in research and on certain doctors' websites out there to help them. And I'm talking about those that had the disease and those that got vaccinated because they even found in the literature that I read that there was even more of association with those vaccinated with having these symptoms, which is very interesting. So just things to be aware of, because there are amazing supplements out there that can help. And just to kind of like pique people's interest, a couple of note just to look into. These are ones mentioned by Peter McCullough and his team would be bromelain, nattokinase, curcumin, quercetin, and NAC. So those are the big ones so far that they've noticed have really helped with these things for those that are suffering due to like COVID. So yeah, go down those rabbit holes as well. So yeah.
Yeah, lots of things to investigate and look into. And for you listeners, I will link that expert review in the show notes, as well as any other information Dominic wants to leave for y'all. So, Dominic, thank you again for your time. What a blessing it is to have the show. This was a very valuable podcast, and I appreciate your insights. And to all you listeners out there, thank you for tuning in today. We will catch you next time on the Kingdom Strength podcast. God bless.
God bless. Thank you.